The UK variant of the deadly coronavirus has mutated again. Now, public health officials in the UK are currently investigating cases of the coronavirus with worrying genetic changes. The latest tests have shown a mutation called E484K present in the UK strain. Now, according to the Public Health England report, the mutation has been newly detected in at least 11 samples of the mutant variant. It also appears that some of these samples may have acquired this mutation independently, instead of spreading from a single case. Now, this mutation has already been seen in South African and Brazil variants of the COVID-19 virus. Experts fear that this mutation could evade the immune system and that the vaccines may prove less effective against these further mutating strains. But the other opinion says that the situation is not as grim as it appears. It is the virus's nature to mutate. Now, early results from major COVID vaccine manufacturers hints at the same. Early results from Moderna suggest its vaccine is still effective against variants with this mutation. Now, although the body's immune response may not be as strong or prolonged, and as we discussed the mutant variants, Pfizer has said that its vaccine may not be as effective against the South African variant strain. The findings come as the UK is conducting urgent door-to-door surge testing in southeast England to try and trace every case of the South African variant of COVID-19. On Tuesday, the UK Health Secretary, Matt Hancock, said that the government is working closely with pharmaceutical firms in case vaccines need to be modified to tackle new variants.
And we're also monitoring the results of work to understand the efficacy of the existing vaccines against the variants of concern. We do not have a point estimate for the difference in the efficacy of the vaccine. The efficacy needs to be measured both in terms of your likelihood of catching the disease.
Now, we're being joined by Mandy Clark, our bureau chief from London. Hello to you, Mandy. Thanks for being with us on this broadcast. Now, there are studies showing further mutations of the coronavirus. Some are warning that the vaccines won't be as effective. Others are saying that this is to be expected and it's not as bad as it seems. These mutations. Take us through these two varying opinions.
Well, of course, when it comes to viruses, they do mutate. That is their nature. But it is a worrying sign about these mutations being less effective. What was interesting is one of the vaccine makers was speaking today, and they said, look, we can tweak the vaccine. It takes 3 weeks to tweak it for that mutation. Now, that doesn't mean it's 3 weeks and then they can get that fixed, but it only takes 3 months production. So it isn't as dire as it seems. It doesn't mean that the vaccines will be useless against it. It just means that that second dose might need a tweak. That's what some experts are saying. Of course, others are worrying that during this mass rollout where we really need that a level of inoculation, that level of dampening down the spreading of COVID, if that variant is resistant to it in some way, it won't essentially slow it down. So there is hope that they can tweak the vaccine, but of course that means that's pushing it a bit further down the line.
Right, Mandy, take us through the latest on the new study that has been revealed by AstraZeneca, Oxford, that the COVID-19 vaccine from them not only protects people from serious illness and death, but also significantly slows the transmission.
That is the piece of good news, which is, of course, the vaccination rollout is important for every country. But the worry is that just because you're inoculated doesn't stop you spreading the disease, so you might still be a carrier. It looks like, at least with the AstraZeneca Oxford jab, that it does also slow down that spread. That is a really key finding. It's really good news for slowing down the spread of COVID-19. Hopefully we will see those same effects along with other vaccines, but it does one big bit of positive news, because what we need is the slowing down of the spread. And so it looks like the Oxford jab does do that.
Right. And Mandy, finally, what is the latest following Matt Hancock's briefing this morning? What is the latest situation in the UK?
Well, the number of cases are going down. Of course, there is that concern about the mutation, which is the South African variant, and we have a number of pockets across the UK where they have been locked down and they're doing door-to-door testing to really ring fence those cases. There's 14 cases that worry could spread more, but at the minute the cases are going down. The UK remains in a lockdown. It will remain so, and there will only be an update on the February 20th. But currently, it's going the right. The mass vaccination is rolling out quite well. So, from the viewpoint of the UK, it's going in the right direction, but it's not under control. And the big worry, of course, is that South African variant spreading.
Right, Mandy, thank you very much. Great to speak to you as always, bringing us all the latest details. WION, now available in your country. Download the app now. Get all the news on the move.